Good morning and welcome. Thank you for joining us for our Northern Light Health, Good Health is Good Business Zoom conference. Tis the season for blessings and well wishes to those we know and love. Proclamations of good health and happiness in the year ahead are heartfelt and shared widely across our communities. And as we consider these genuine hopes for others, let's give thought to what role employers can and should have in supporting employee health as the new year approaches. Have you ever considered what social factors are contributing to the health of your employees? Perhaps you have an employee who continues to struggle to find childcare. Maybe you have an employee who is struggling to repair their vehicle or replace their tires. Do you have an employee who is worried about affording oil this winter to warm their home? And have you ever considered how these social factors are impacting your employees' ability to be present at work and prioritize their own health? Today, we are focusing our discussion on social determinants of health and what action employers can take, often in partnership with other community based organizations, to address these barriers in support of their employees' health and well being. We hope that you will find this hour inspiring as it will demonstrate the power of collective action and influence. I'm Karen Hawks, Vice President of Operations at Northern Light Beacon Health, and I'll be your moderator for the next hour. Please join me in welcoming our expert panelists for today. We have Dr. Jim Jarvis, Senior Physician Executive at Northern Light Health and Director of Clinical Education at Northern Light Eastern Maine Medical Center. Jessica Schaefer, Director of Community Health Partnerships at Northern Light Health. Jamie Rogers, a licensed clinical social worker and the Director of Community Care and Behavioral Health at Northern Light Health. Dr. Elizabeth True, Vice President of Student Affairs at Eastern Maine Community College. Jana Heath, Wellness Program Manager at the Jackson Laboratory, and Ryan Albert, Senior Vice President and Director of Human Resources and Employee Development at Bangor Savings Bank. Thank you all for joining us. Before we get started with today's panel discussion, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. The information presented in this session is provided for educational purposes only and is not meant to substitute professional or medical judgment. Northern Light Health does not know the particulars of your situation, so the information presented today is intended to be general in nature and may not apply in every individual situation. Northern Light Health and the presenters make no guarantees or warranties regarding any information provided today. So with that said, this hour is intended for you, and we welcome and encourage your questions at any time using the question and answer function. Also, I hope each of you will take a few minutes immediately following this hour today to answer a quick 5-question survey. Your input directly influences the topics for future Zoom conferences. We will begin today's discussion by asking Dr. Jarvis to provide additional information about the recent health news we are reading about and hearing about in the headlines. So good morning, Dr. Jarvis. Thank you for joining us.
Good morning, Karen, and thank you for having me, and thank you all those that are attending. First slide, please. I'll give a quick update on where we stand with the COVID-19 pandemic.
Dr. Jarvis,
yes,
before you get started, we'd love to see your face. So there you go.
There we go.
Thank you.
I double-clicked on everything. Hospitalizations across the state of Maine have been stable or reduced over the past 3 weeks due to COVID-19, and that's great news for us. However, our positivity rate, which is that number of total positive tests divided by the number of tests we have run, has increased over the past 3 weeks in many parts of our state, and we're starting to see those cases rise. Unfortunately, recently, the last monoclonal antibody that we have been using for treatment of COVID-19 for people with mild to moderate disease who are at high risk for severe disease was pulled by the FDA. And this was due to the fact that the new circulating variants of COVID-19 have been able to evade the protection that those monoclonal antibodies afforded us. The good news is that we still have Paxlovid, which is an oral antiviral agent, and it is the most effective treatment for mild to moderate disease. And it is highly recommended for individuals who are over the age of 50 who contract COVID-19 or anyone with an underlying health condition that puts them at risk for severe disease. I do want to touch on some media highlights recently that talked about the risk of dying from COVID-19, particularly stating that more people who are vaccinated are now dying from COVID-19 than those who are unvaccinated. However, the risk is higher for people who are unvaccinated to die. So let's take a look at some numbers as to why that might be. So next slide, please. So this graph basically plots the number of cases of COVID-19 and the rate of deaths for different populations based on age. It divides them out into both vaccinated and unvaccinated. So let's look at the people who are at most risk, which we know are people over the age of 65. Next slide, please. If we compare those numbers, and you can see as we go across the graph that in the midway point of the graph, you can see that deaths from COVID-19 were quite high. And that's when we were dealing with a particular variant that was more deadly, and we had less treatments for COVID-19. But during the entire graph, if we look at it, people who were unvaccinated, both over the age of 65 to 79, or those over the age of 80 who are at the highest risk, still top the list, even when we compare that to people who are vaccinated who are over age 80. And again, those are at the highest risk. So vaccinations clearly protect you from death, regardless of the fact that right now more vaccinated individuals are dying from COVID-19. So why is that? Next slide, please. It's purely a factor of math. And that's because there are way more people right now who have had some level of vaccination than there are people who are completely unvaccinated. So 80% of the United States population has received at least one dose of a COVID vaccine. And when we look at these numbers, they're talking about at any level of vaccination. So even if they've just received one dose, they are in that group of vaccinated individuals. Of the population that is most likely to die from COVID-19, those over 65, 95% of the population has had at least one dose. And 32% of that particular population has had the bivalent booster, which we know now is very effective at preventing serious disease, hospitalization, and death. Unfortunately, only 12.7% of the entire population has received that specific bivalent vaccine. Next slide, please. What about other respiratory viruses in Maine? We've heard a lot in the news lately about RSV and influenza. And we can see, looking at this graph, that the blue line represents new cases of influenza across the state of Maine, looking at Northern Light Health's laboratory data. And we can see that over the last few weeks, we've seen a significant increase in that positivity rate. And now that it's over 25%, it is extremely early in the influenza season for us to see a spike like this. And in my career, I have never seen a positivity rate this high for influenza. At the same time, we can see that RSV, which typically causes common cold symptoms in most individuals, but can be seriously ill in children under 1 year of age, and particularly those under 6 months of age, or anyone over the age of 65. Also, we are seeing that the rates of RSV continue to be very high, including our positivity rate being above 20%. And so there are these three respiratory viruses out there are causing significant disease here in the state of Maine. Next slide, please. So what can we do? We can continue to do the things that we've been preaching about for the last 3 years. Continue to wash your hands and use hand sanitizer. I implore you to make access to hand sanitizer to your staff, your clients, and your patrons so that they can continue to keep themselves safe. We recommend that people stay home when they're ill. So again, as employers, if you can support that for your employees to stay home when they're ill. And then, of course, get vaccinated against influenza and COVID-19. Vaccination is still the single best way that we can help prevent people from getting seriously ill and prevent spread. I just want to end with just a quick comment that the CDC is now looking at more direction around masking. Why? Because as we see this now tridemic or tripledemic of RSV, COVID-19, and influenza spreading across the country, we know that respiratory virus spread can be limited when people mask. And so we will see more public health recommendations for people to mask out in public places. And it has always been my recommendation that anyone with any health risk wear a mask when they're in an indoor public space. And with that, I'll turn it back to you, Karen.
Thank you, Dr. Jarvis. And a quick follow-up question. Do you have any sense as to why the influenza and RSV rates are so high compared to prior years?
Yeah, so I think it's a multifactorial issue. One is that we had very good respiratory virus seasons over the last few years, with the exception of COVID-19. COVID-19 kind of forced out all the rest of those viruses, mostly because we were all doing all the wonderful things that we were supposed to be doing, wearing masks, washing our hands, staying home when they were ill. We know that people have relaxed on a lot of those conditions. We also know that particularly with influenza, it is a particularly virulent strain, meaning that it causes more severe disease than we typically see in a flu season. We know that because typically influenza season starts in the Southern Hemisphere, and we have great data from both Australia and from South America that this was going to be a bad flu season. The good news is that because we had that kind of warning, the flu vaccine that we have this year is a very good match for the current strain that's circulating both in the United States and here in Maine.
Thank you. And I assume that that influenza vaccine is widely available.
Absolutely.
Do you have any idea what the vaccination rate is for the state of Maine? Is it higher or lower than what we would typically see?
It's behind where we need it to be. That's about the best information I can give you. We don't have any specifics right now. We know that people, because the last 2 years we haven't seen much influenza, people start to get a little bit complacent and think it's not something they need to worry about. But this year we absolutely need to worry about it because it is a strong strain. It is causing a much higher rate of hospitalizations, and it hit us much earlier. So if you have not yet got your flu vaccine, or if you're a family member, friends, or your employees have not yet, please support them in getting it.
Thank you so much, Dr. Jarvis. Appreciate that information, particularly that last message. So please make sure you seek out that vaccine if you haven't already. We've also provided a link here to the Northern Light Health page where you can find access to the COVID-19 booster. We saw that the vaccination rates for that booster is quite low at 12, just over 12%. So there's lots of opportunity there, and that is widely available as well. So thank you so much, Dr. Jarvis.
Thank you, Karen.
Yes, absolutely. I would now like to take the opportunity to transition our discussion to today's primary focus of conversation, which is social determinants of health. Social determinants of health is not a new term. A United Kingdom study in 1967 demonstrated that higher socioeconomic status predicted better health, and in contrast, lower socioeconomic status predicted poorer health. Through the years since then, there have been many studies, papers, and programs focused on this topic that further support and expand upon the UK study of the 1960s. In the United States, focus on social determinants of health began to gain traction back in the 80s when the US Department of Health and Human Services formed the Task Force on Black and Minority Health in 1985. While the impact of social factors on health is not new, and certainly there is wide acceptance, there seems to be a renewed focus and energy throughout the country to take collective action. I am very honored and pleased to welcome today's panelists who will share insights and practical approaches to support employee and community health by identifying and addressing social barriers. I have a feeling you're going to have many takeaways from our hour together today. Our first two panelists, Jessica Schaefer and Jamie Rogers, will help set the stage for today's discussion by ensuring we all have a shared understanding of social determinants of health. So thank you both for joining us, and I believe Jessica is going to get us started. Thank you, Jessica.
Thank you, Karen, and thank you for teeing up social determinants of health. If you listen to some of the examples Karen provided at the start of this meeting around social determinants, such as housing, childcare, transportation, you can probably glean that these are really complex problems that no one person or organizations can solve. So understanding where we as organizations can best help is just as important as knowing how we can help. Next slide, please. So to illustrate this, I'd like you to imagine that you're standing next to a river and you notice that people have fallen in the water and they are being swept through the current towards you. You can see that these people are close to drowning, so you begin to pull them out of the river one at a time. They've spent quite a bit of time in the water, they're cold, they're injured, and they're likely to have some long-term effects from this experience. So right now you're downstream from whatever's happening that's putting these people in the water, and you're primarily addressing the effects of the problem. In terms of social determinants, helping people at this point is often more expensive in terms of healthcare utilization and healthcare costs. And from an employment perspective, it makes it a lot harder to maintain a healthy workforce and a productive workforce. So you look a little bit further up the river and you think, well, what if I went up there and I threw life rings to these people? That would probably prevent them from drowning, which would help. But some of those people will remain in the river and continue to struggle. Eventually, you may ask, why are all of these people falling in the river and what can I do to prevent it? And when it comes to social determinants of health, this is the area where we at Northern Light Health and other organizations are starting to look to and ask, how can we address the root cause of the problem? This is also the area where community partnerships are so important. So for example, building a bridge that would keep these people safe would require the contributions and resources of many different partners. All of this downstream assistance I talked about earlier is really important, but wouldn't it be better if we could just prevent people from falling into the river in the first place? Next slide, please. So if you think about social determinants of health as the river, it helps to illustrate why it's so important to prevent people from falling in or to catch them sooner. That concept of upstream or downstream assistance can also reveal the role and the power that businesses and other organizations have in supporting the health of their employees and also their communities. This could start with individual efforts, such as developing an organizational policy to improve work environments or benefits programs, or providing assistance programs for employees that would either prevent them from needing further help or address any current needs that they have. Where it becomes really impactful is when organizations can work together in this middle section of the stream to advocate for the social health needs of their communities and develop or contribute to community capacity building, or at a very high level, work together to advance community level policy that supports healthy communities. And now I'll turn it over to my colleague, Jamie Rogers, to tell you a little bit more about how community partnerships work to improve health.
Thank you, Jess. As my colleagues have shared, social and environmental factors have very real effects on health and health outcomes. Generally, we find that communities and neighborhoods often have similar characteristics that impacts residents' health in similar ways. For example, a community that has walking trails or bike paths generally has people who are more active than those without access to safe local places to exercise. People living in these locations are more active than those who live in communities where the sidewalks are crumbling, or those who live in neighborhoods where it's not safe to even be outside at all. If we focus on reducing barriers and improving communities, we will have healthier people. Keeping people healthy is the #1 goal for healthcare providers, not merely taking care of them when they're sick. But it takes a village to establish healthy communities. It takes everyone at virtually all levels of government, businesses, both large and small, schools, and engaged community members to make our communities healthy and vibrant. At Northern Light Health, we are working towards achieving healthy communities. We want to see all people achieve the highest level of health possible for themselves. To accomplish this, we are placing focused and ongoing efforts to address avoidable social determinants of health. While income is not the only social factor that impacts health, it is often the easiest example used. Low to moderate income communities tend to suffer much more from health issues than wealthier neighborhoods. Why? Because our income directly impacts so many aspects of our overall health and well-being. For examples, nutritional status, the absence or presence of nutritious foods, and our ability to pay for them, that impacts our health. Health insurance status, our ability to afford copays, deductibles, or access medications for either acute or chronic illnesses, that also impacts our health. The type of housing we live in, is it safe? Is it adequately ventilated, heated, and in good repair? This impacts our health. And access to reliable transportation to medical appointments. You guessed it, that also impacts our health. If achieving the highest level of health for everyone across all communities in Maine and beyond were easy, we would have done this a long time ago, and we would not need help. But this is a large, bold goal with complex and multi-pronged answers. This is why we say it takes a whole village or multiple villages to find and create the solutions to these complex problems. We need all hands on deck. Next slide, please. This is why the healthcare delivery system is invested in community development and organizing. We can't do it all, and we definitely can't do it alone. We need to collaborate with all organizations of all kinds and types in order to champion and foster collaborations, partnerships, innovation, creativity, and building of ongoing trust and camaraderie with the members of each community to identify the root causes and challenges that they are experiencing, just like Jessica shared using her bridge example, and to design and implement appropriate, viable local solutions. It's imperative that our partnerships are far-reaching and that we are including community members or those that will receive the resulting intervention as full partners. We must ask them for their opinions, invite them to vulnerably share their needs, and bravely share their ideas to solve for those needs. It is not enough to bring solutions to communities or recipients and solve for them. We might have great ideas, but these ideas might not be culturally relevant, or worse, they might not even be the solutions to the real problems that community members really have. We need to act as conveners to get stakeholders, including the intended recipients of the service, to weigh in on their view of both the problems and the solutions to those problems. When we work together to solve problems with others, we will have the best, most long-lasting, and most impactful results. And now we'll share experiences of a few employers and businesses who, with their employee needs top of mind, are supporting their employees and their families in areas such as housing, transportation, food access, and others. Karen, back to you to introduce our friends from the Jackson Laboratory.
Thank you both. Thank you so much. And I can't get over that river analogy. It just makes it so clear. So appreciate both of you for helping to set the stage for our conversation today. And so what does this all look like when we're actually putting it into action? And it's really my pleasure to have three people who are representing their organizations to share their story, and the work that they're doing is just, it's incredibly inspiring. And we'll get, certainly, I think you'll leave here today thinking about how you might be able to start taking some action. So our first panelist is Jana Heath from Jackson Laboratory. And so thank you so much, Jana, for sharing your story with us today. We look forward to learning from you.
Thank you so much for having me. Just a quick note, we reference ourselves as JAX at the Jackson Laboratory, so I'll be mentioning that throughout, and I didn't want to confuse you. So with the Jackson Laboratory, we're a biomedical research company, and really my job as the wellness program manager is to take care of the people who are trying to take care of others. Our goal is to improve human health, and here are some ways that we are trying to do so just within our own JAX community. So we start with competitive pay with full coverage benefits, and that includes additional COVID PTO and PTO for volunteering. JAX also contributes to the employees' 403B retirement fund, regardless of whether the employees contribute anything at all. Shuttles. So many of our employees commute over an hour to our Bar Harbor location. It's very remote, and as you can imagine, commuter buses and things are scarce. So what we've done is we provide a free shuttle between our campuses in Ellsworth and Bar Harbor, and we also encourage our employees to reduce their carbon footprint. So we have electric charging stations available for our employees to use while on site. We're big champions of career growth, so we support our employees continuing their education with tuition reimbursement. And speaking of tuition reimbursement, we've also partnered with Tuition.io to help our employees manage their student loan debt, as well as assist parents, to help them find ways to save and pay for their child's education. We have lots of career advancement opportunities. We really do champion our employees, and we provide education and trainings to help connect employees with new opportunities within our own organization. We really do like promoting within the organization. Affordable housing. So that's a crisis throughout the United States, but specifically in remote locations like Bar Harbor, Maine. So what we've done is we have several apartment units available to JAX employees located within walking distance from our Bar Harbor campus. And we continue to assess how we can best meet the employees' needs. And one of those needs is childcare. So we currently have a childcare facility in our Ellsworth location. We partner with the Down East YMCA. And we just broke ground on a facility on our Bar Harbor campus. And this is in response to the child care shortage in Maine. I'm sure you can tell that we really are trying to assess the needs and find ways to not only provide resources and to sort of connect them with those resources, but also just ways that we can participate in that. And so we have our EAP services. So those are employee assistance programs in place to support our staff with behavioral health, financial wellness, stress, and more personal and professional resources. Our employees, they have access to counseling, and that's telehealth and in-person counseling, coaching sessions for professional and personal challenges they might face, legal consultations, you name it. We've also identified that depression is the #1 health issue among our Maine employees, with hypertension being a close second. So in 2023, I'm launching the You Are the Heart of JAX campaign, and we will provide wellness initiatives and resources to address and support those health issues. We have on-site fitness centers at all of our locations. They're free and available to all employees and their spouses, and they're open 24/7. We have rewards for wellness initiatives so they can earn money towards their HRA and HSA. And we offer many wellness activities, workshops, lunch and learns, and more ways for employees to earn wellness rewards credit. We partner with Wellbeats. That's a company that provides on-demand fitness classes. And we also have live classes. They're currently on hold during COVID, but I'm excited to sort of announce that we're going to be bringing that back in the new year. We also recognize that proper nutrition plays an important role in all facets of our health. So we offer a reduced price for healthy food items in our cafes, and we run programs to help employees who are seeking nutritional support. Next slide. So we have a few exciting things going on. We have our Employee Crisis Support Fund. So what that is it provides financial assistance to eligible JAX employees who experience a hardship due to an emergency situation beyond their control. We provide several opportunities to volunteer within the community, and we provide resources and support to veterans. We've recently adopted a service dog who we named Jax, of course, who is being trained to work specifically with veterans with disabilities. And we're currently running, if you want to just move to the next, just advance a little bit, we're currently running our JAX Cares campaign, and that allows JAX employees to support local nonprofit organizations of their choosing or make a donation to the JAX Employee Crisis Support Fund. We also have this JAX Endowment for Diversity initiative. So we have a really strong DEI program here, and what's happened is our DEI director created this endowment to advance our reputation as a place where individuals across the organization feel valued, included, and empowered. Our employee recognition program, our gratitude is in our DNA, empowers our employees to say thank you to our peers who contribute, and really to recognize them for milestone achievements. And then finally, I'm really excited that we just gifted all of our employees the Calm app. And what that really was it was response. It was really a response to employees coming to me and saying, I'm very stressed. I don't know what to do. I can't leave to go outside and take a walk, or any of the other normal sort of suggestions I might make. So what this is it's an immediate, convenient, personal, and private way to manage their stress. And it's available to all of our employees and up to 5 of their dependents. And we really hope this supports not only the employee, but their families to try and create a more peaceful environment and a way to reduce stress for them. So we're really excited about all the opportunities we've sort of made available and ways we support our employees. And we're always working daily to try and really find new ways. So as a member of the panel, I'm excited to learn from the other panelists here on ways that maybe we haven't contributed. So with that being said, I throw it back to you, Karen.
Thank you so much, Jana. I really appreciate the energy. Clearly, you're very passionate about this. And you said there's a few things that you're exciting. And I have to say, there's many more than a few. Everything you said here is pretty exciting. So really appreciate you sharing the story. I think there's so many takeaways from what JAX is doing to support your employees. So thank you so much.
Thank you.
Our next panelist is Ryan Albert. Ryan's actually joined us once before on this Zoom conference, so it's nice to know we didn't scare him away, and he's willing to come back and share some insights regarding what Bangor Savings Bank is doing to support not only their employees, but the community. So thanks so much, Ryan, for joining us back.
Thank you, Karen, and good morning, everyone. It's truly a pleasure to be back with you all today. Since 1852, it's been the mission of Bangor Savings Bank to provide our employees a rewarding place to work, to support the financial needs of our customers, and to grow and invest and do all we can in our communities. To that end, it all starts with a genuine focus on the overall wellness and engagement of our 1,100 plus employees. On the heels of the pandemic, I'm sure we're all seeing increases in stress, in anxiety, and depression. So this year, we've really placed a greater emphasis on supporting the mental well-being of our employees. We offer flexible work arrangements, including work from home, hybrid work schedules, generous amounts of PTO to help employees find a nice work-life balance by providing them as much time at home as possible. And for those seeking to speak with a professional, we have an EAP program available. So all of those things sort of help with our employees' mental well-being. We also promote physical wellness. We give all employees a free Fitbit. We conduct bank-wide challenges through that Fitbit app. We have a pretty impressive fitness center here at our Bangor campus. And throughout all of our locations in Maine and New Hampshire, we offer our employees free or reduced gym memberships. Our bank-wide chair massages have been a huge hit. So all of our locations, 70 plus, have on-site massages a minimum of once per quarter. Again, that's been very well received. And thanks to our amazing partnership with Northern Light Health, over 97% of our staff is fully vaccinated, which I think is pretty impressive. As a bank, we're also strong supporters of our employees' financial health. With 8% inflation, record high heating costs, we know that some employees are struggling financially. So we're proud to be able to offer them 0 interest, easy payroll deduction loans, free financial education. And then we have an employer relief fund, which is available for anyone experiencing sort of an unexpected undue hardship, where they can reach out confidentially and we simply deposit money into their account to help them in any way that they need it. So in addition to employee wellness, we place a huge emphasis on ensuring our employees are engaged and motivated. So we offer a lot of opportunities to serve on employee-led committees, such as our DEI Council, which helps us ensure a diverse, equitable, and inclusive workplace. Our campus committee, they get to do all the fun stuff, organizing, barbecues and cornhole tournaments, all of those things to keep people sort of motivated and connected. And we also have virtual activities such as book clubs, trivia nights, to help those stay connected even when they're working remotely. Next slide, please. So when your employees are healthy, motivated, and engaged, now they're excited and ready to make a difference in the community. So at the macro level, Bangor Savings Bank has an organization. We've invested over $3.4 million last year into the community in the form of sponsorships, partnership, and grants. So that's sort of at the macro formal level. But our individual employees are also heavily involved in supporting our communities. We provide each employee with 4 paid volunteer days off each calendar year. So they get up to 32 hours to go out and volunteer at a local nonprofit. And trust me, we use all 4 of those. No problem using those days up. We're huge supporters of the United Way and Maine Share, which is a great way for us to support organizations throughout Maine. Our annual peanut butter and jelly drive has been a tremendous success, probably beyond what we even expected. This year, we raised over 15,000 jars of PB&J and traveled throughout Maine and New Hampshire, donating those to local food pantries. And those food pantries were really desperate for protein-rich foods. Peanut butter is such a great source of protein and it's shelf stable. So that was a nice option there. And of course, you can't have peanut butter without throwing in some jelly. We actively support our veterans and our military as well. We have a homegrown military appreciation group that buys and serves meals to our veterans. Another thing we're proud of is each November, all of our locations glow green in honor of our military, and you can see a nice picture there on the slide of that. And an initiative that I'm especially proud of is one that we call Be Kind. Each and every one of our 1,100 employees receives a $50 bill at the beginning of December, and their task was simply performing a random act of kindness in their community. And it's totally up to them how to use it. It could be anything from purchasing a gift from the angel tree, putting it in the Salvation Army bucket, paying for a stranger's groceries, or buying pizza for the homeless shelter and delivering it to them for a meal. It's really just a wonderful way to spread kindness throughout our communities. And our hope is that that kindness is contagious, because together we truly can make a difference in our communities. Thank you so much.
Thank you, Ryan. I absolutely love the Be Kind initiative. I learned about that for the first time from you on Tuesday, and I've been thinking about it ever since, because what a powerful movement, particularly in this day and age. And I do think kindness is contagious. So kudos to Bangor Savings Bank from that initiative. It's a very exciting one, and I'm sure all of your employees get tremendous reward for having the opportunity to give. So thank you so much for sharing. all that story of Bangor Savings Bank. And as we reflect on the work the Jackson Bangor Savings Bank is doing to support employee health and to make an impact in our communities, let's consider how we can support and prepare tomorrow's leaders. I'm very pleased to have the opportunity to welcome our final panelist this morning, Dr. Elizabeth True. Eastern Maine Community College has taken action to support students' health by addressing social determinants of health. So we're really looking forward to hearing from you, Dr. True. Thank you so much for joining us.
Two buttons. Good morning. My division at the college is responsible for all aspects of the student experience outside of the classroom, from application through graduation. At Eastern Maine Community College, we serve a large population of first-generation students for whom a college degree can significantly impact their ability to afford the services important to maintaining physical and mental health. However, social determinants of health can also have an adverse impact on students' ability to succeed and achieve their degree. Next slide, please. As you can see from this slide, each degree, including a high school diploma, has a positive impact on median earnings and also diminishes one's chances of unemployment. As many of the social determinants of health are impacted by one's socioeconomic status and ability to afford services such as medical care, mental health treatment, and good nutrition, it is clear that higher education has a significant return on investment. While not included in this chart, jobs with benefits such as paid sick leave and health insurance are also more likely to require some form of college attainment. Next slide, please. My colleagues at Eastern Maine Community College and throughout higher education have noted some key trends regarding the impacts of the pandemic on college students. The most predominant is the significant rise in mental health diagnoses, particularly of depression and anxiety. However, the silver lining is that students are much more comfortable now talking about and asking for help with mental health and self-care. Research is showing that traditional age students are experiencing up to a 3-year delay in cognitive and social development as a result of the isolation of the pandemic, as well as the pivot to remote and hybrid learning the pandemic caused. This is particularly problematic for college courses, which assume students arrive with the appropriate math and science preparation. There's also a significant increase in students requesting accommodations for diagnosed learning disabilities. While food insecurity was previously a problem for a portion of our population, the pandemic exacerbated but also illuminated the problem. Increasingly, more students are experiencing at least some periods of food insecurity, which of course impacts their ability to learn and succeed. The increase in transportation and housing costs in our area have also created barriers to access education or simply get to class. Finally, our students who are parents have challenges in finding childcare that is affordable and also compatible with their class schedules. Next slide, please. So Eastern Maine Community College has developed strategies to help our students overcome these barriers. We began our food pantry several years ago, but are expanding rapidly to serve more students and even provide delivery services. We're fortunate to have received grants from the Melmac Foundation and the Maine Department of Agriculture to fund an AmeriCorps Vista volunteer to help expand the food pantry, build a community garden on campus, and educate the community about the challenges of food insecurity and opportunities for students to access healthy food. Penquist has a childcare facility on our campus, which is open to our students as well as the local community. The Free College Program, which I hope you have heard about, proposed by the governor and approved by the legislature, funds free tuition and fees for students from Maine who reside in Maine, who graduated from high school or received their GED in 2020, 2021, 2022, or even this coming spring. While many students were already eligible to receive federal grants to cover tuition, this program has encouraged many others to consider community college, either for a degree here or as a stepping stone to a 4-year degree. The program also funded 3 staff members to assist prospective and current students through the application process, as well as advising once they are here. We also have a staff member called the Navigator, whose role is to assist students with overcoming obstacles by connecting them with community resources. Our federally funded TRIO program works with students from low socioeconomic backgrounds to provide additional support, tutoring, and skills for success. They sponsor a monthly lunch and learn program of workshops open to all students on a variety of topics to foster success. We draw students to those with a free lunch. Finally, our school psychologist offers free short-term counseling services and referrals for long-term counseling. She and I co-chair our campus care team, which responds to reports from faculty and staff about students of concern. When a student is referred to the care team, we decide the best approach to assist them and reach out to offer that assistance. I'm proud of the work we are doing to help students train for those good jobs available in our state, which will help them access the best resources for good health. Thank you.
Thank you so much, Liz. Really appreciate the work you're doing to support tomorrow's leaders, helping them to support not only their education, but getting them set up for a healthy life. And it's important to know that the graduates of Eastern Maine Community College are tomorrow's employees. And so how can that support continue? Because we certainly know that that need isn't going to go away simply because they're leaving the community college system. So that's something that we need to be mindful of as we look for opportunities to support our communities and our youth and our young leaders. So thank you so much. At this time, I'd like to invite all of our panelists to turn on their cameras as we transition to the roundtable portion of our conference. And again, I would like to invite our audience to submit any questions for our panelists using the question and answer feature. We'd certainly welcome them, even if you want to ask questions about a particular program that you might have heard about today. They are all here willing to help and provide additional details of interest. So with that said, I'm going to start with a question that's really for all of our panelists. Dr. True provided some insights into the why regarding why Eastern Maine Community College saw the need and the impact of that pandemic. I'm interested to hear from the other organizations who have joined us as well. And certainly, Dr. True, if you have more that you'd like to add, feel free. But the question is, what prompted your organization to begin focusing on social determinants of health? Why did you begin to take the action that you've outlined today? And I know some of you, the organizations have been doing it for so long, but I really love to hear some more background about the history of how you started this important work. So Jana, maybe I'll start with you.
Sure. Quite honestly, when we talk about our values, our people really, I mean, we're nothing without the people who are doing the work. It's really important to walk the walk. If we're in the business of improving health, human health, we really have to start with within. And I just feel like it's almost sort of an honor to be able to be tasked with the role of making sure that employees have what they need. So I love being an advocate for them. And we really just stop and we just speak to our employees and we listen. I think through listening and really hearing what the needs are, then we can explore. And we're certainly not shy of saying, oh, we need to do better, right? And so I think that's where it started. And then just identifying those needs and seeing how can we take care of them. So by basic needs of gas prices, food, daycare, childcare, how do we attract good employees? How do we keep good employees? And how do we take care of them? And I think that's just where the conversation started. And I think there's really a rabbit hole of things that you can do. I'm really impressed by Bangor, the savings bank. I mean, all of the things, gosh, I mean, wouldn't I love to have a massage once a quarter, and I know we're all in a good mood after that, aren't we? So, I think that we can learn. I think it's exciting to learn from each other, but I think just starting, with something small, like identifying one problem, because it can be very overwhelming. You want to save everyone and fix everything. So I think if I had to give advice, it's identifying a problem, trying to find an immediate solution, and then look for a larger scale solution down the road. So a shuttle is a small solution. A larger solution is bringing affordable housing. So that's I guess what I would start with.
Thank you, Jana. Ryan, I'll toss you the ball to see what you have to say. Yeah.
Yeah. So I guess the easy answer would be, we've been doing this since 1852, employees, customers, communities, but really, I think we've always been great at addressing the financial needs of our employees, customers, and communities. But as we all know, there are many other ways that we can help as an organization now beyond just the financial. So we task, we have 75-ish locations spread throughout Maine, New Hampshire, and even a little bit into Mass. We task all of our branches, all of our locations to sort of be the eyes and ears of those communities and to bubble things forward if they see a need. And again, it's not always financial. Sometimes it's volunteers that they need more than anything. And to bubble those up to us on the leadership team so we can address those. And then we're careful to communicate to our employees. I think everyone wants to make a difference, but they don't know where to start sometimes. They're not sure where the need is. So it's incumbent upon us to make sure we're publicizing that, letting people know where the volunteer opportunities are, and they're more than willing to get out and help for sure. But our fates are intertwined. You can't have a successful business without successful communities. So we're all in this together. Our employees they don't just work in the communities, they live there, they're woven into the fabric of those communities. So it's good business, and it's just the right thing to do at a human level. It's just making sure people know where to help and how to help, because they definitely want to.
I love that. Thank you so much, Ryan. And I think I'd be remiss if I didn't take the opportunity to thank Bangor Savings Bank, because your employees played a critical role in staffing the COVID-19 vaccination clinics. And we couldn't have done it without the organization promoting those volunteer opportunities. And every employee that volunteered came in with a smile on their face and a can-do attitude. And it was just a pleasure. So you definitely, walk the walk. So thank you.
Yeah, and thank you. And again, through our partnership, you guys reciprocated and came on site, and 97% of our staff is vaccinated because of Northern Light Health. So that's just a good example of, we can all work together to support our communities and each other.
Absolutely, absolutely. Dr. True, I wanted to invite, if you have anything additional you'd like to add in terms of, why your organization prioritized your students' health and tackling it from a social determinants of health angle.
I think in some ways it started because of the Federal CARES Act funds that were made available to us to help students, and we asked them to submit applications about how the pandemic had impacted them and why and how would they use any funds, and that really provided us some data on what their needs were. We still are able to use some this year, but that fund is going to run out. And so we looked at ways to, for example, with our food pantry, to expand it and make sure it's self-sustaining without these great grants that we have now. And so the garden is another way to expand that. So I think it really was that data prompted by the pandemic, as well as our students, again, I think are more comfortable now to asking for help and saying, I need help. And that's, if there's a silver lining to this, that is it.
Yeah, absolutely. I appreciate, I love that last tidbit, right? Giving people empowering people to ask for help. And that's certainly supported by Bangor Savings Bank and Jacks with the Employee Relief Fund and the Crisis Support Fund. You're both taking a very similar initiative to help support employees from who might have some crisis that need to seek assistance from their employer confidentially. So I appreciate that work. And Jamie and Jessica, I want to invite you also to contribute from a health systems perspective. Certainly social determinants of health has been in the public health, language for decades, but it does feel as though health systems across the country are really taking a renewed focus on how we could be more, have an impact in this. So do you have any insights you'd like to share? Either one of you. Jamie, how about you first?
I was going to defer to Jess. I would say that Ryan's example of how COVID vaccinations and your example of how COVID vaccinations got disseminated both to the public and to Bangor Savings employees is a great example of how we have to partner, not only for vaccinations, but for things like food and housing and other really critical things in our communities. There's a housing shortage in most regions of Maine. There's a long wait list for safe, appropriate housing, and it's very expensive. And so the more partnerships that we can have and the better that we work together with everyone, the healthier all of our communities will be. And ultimately, the more affordable healthcare is. When we're healthier and using healthcare to prevent significant illness, that it benefits all of us in the end.
Thank you. Thank you, Jamie. A follow-up question is regarding, it was provoked by a comment that Jana made in regards to engaging your employees and asking them and discovering what their needs are. I'm curious to know if anyone has used any specific data or collected any data, or perhaps has tips on how to engage employees in those sometimes difficult conversations, or students in those difficult conversations, to ensure that any strategy or initiative that you're implementing will have the greatest impact. I guess I'll start with, I'm going to start with you, Ryan, and see if you have anything that you'd like to share.
Yeah, one strategy we used is, as bankers, we're used to tracking things and we're all very competitive. So we launched a 10,000 hour campaign that we tracked through, through our HRIS system. All volunteer hours are tracked. And we just communicated every day, okay, we're still, we've only got 2,000 volunteer hours in so far, long way to go. Here are the opportunities. Does anyone want to get together as a group on Saturday and go volunteer here or there? And just tracking those hours. And as we approach that 10,000 hours, that was very important to us, and it helped kind of push the needle a little bit. Yeah, just being a little bit competitive and tracking. People were proud to, they would type in, this is what I did this weekend and this is the difference that it made, and it's very special. We'd share those stories.
Love that. We're
Karen,
pretty
this might be
competitive too in healthcare. Go ahead,
Yes.
Jamie.
This might be a leap, but I'm going to suggest that years ago I saw some data that said that communities that had homes with front porches were more friendly than communities that didn't have front porches. I think that what we're talking about here is creating businesses and creating employment opportunities where we have front porches, so that we are making community out of our employees and then encouraging them to go back and use those skills where they live and recreate and do all of their other kind of personal things. So that's what I would challenge us with, is we are helping people to remember that communities with front porches are more friendly.
If I could just speak to the engagement piece, if you don't mind, real quick. I think for the success for programs, especially regarding behavioral health and things that might be a little bit sensitive, or any kind of wellness, it really needs to come from the management. There needs to be examples set from management and leadership. If leadership isn't engaged, it's going to be difficult for the employees to be engaged. It's almost like giving permission, and also creating this environment where it's okay to take that self-care or work-life balance. But it really needs to come from the example of leadership. So, challenges that we've had is, how do we engage leadership? So we've tried different strategies, and I'm always getting into meetings where management is there and just reminding them of the services that we provide, and really also communicating, and Ryan spoke to this a little bit, just as making employees aware of the services, because sometimes they hear words like EAP and it just kind of goes in one ear out the other, but really peeling back that onion and saying, no, these are the specific services we have, and making our HR staff aware. So when an employee comes to them with a specific situation, they can point them to the right direction. So I've created sort of a cheat sheet, like if an employee comes to you with this, here's the service, here's what to do. So those kinds of strategies to not only promote engagement, but to support when they are engaged are things that I would recommend.
Dr. True, I saw you went off mute.
Yeah, I'd like to add in one piece. It ties some of this together. One of the things that we learned was many parts of our staff and faculty are fortunate to come from positions of privilege where we've never had to worry about where food was going to come from. And sometimes it's hard to understand the mindset of some of our students who are facing these challenges. So we actually had a workshop with Renee Muscatel from Penquis on Bridges Out of Poverty, which was really helpful to understand why a student may not be able to pay their bill, but you see that they have a cell phone. Well, they may need that cell phone to work or for childcare and so forth, or why they might miss a class because they have to take care of an elderly parent, and the different rules that exist in different socioeconomic statuses and languages and choices. And this was incredibly helpful at lifting kind of judgments and assumptions so that we could think about different ways to meet our students' needs, but also make them feel comfortable. Our food pantry staff figured out during the pandemic, when we were delivering meals, when students couldn't come to campus, that more students accessed it. If somebody was anonymously dropping it off on their front porch, if they have one, rather than having to walk into the food pantry, they were more likely to access it. And so we've continued that even while we're now fully open without COVID, because that was a way for some folks to feel comfortable getting their food. So those sort of strategies, but thinking outside of your own prejudices and assumptions to understand where students may be coming from. And so I do highly recommend this kind of training for your staff because it really can break down some of those barriers. And Renee's fantastic, and there's also a wonderful book she recommends, and we can share those with the resources.
That would be wonderful, Dr. True. I really appreciate you shedding light on that and providing that different perspective, because I agree it is critical that we recognize our own bias, our own privilege, and make sure that we're very mindful of that going into these conversations and the decisions that we make as leaders. And it's also, I think you've also highlighted the importance of community partnerships and relying on others who have expertise and experience and knowledge to help learn from them. And so certainly take advantage of those opportunities, because there's many community-based organizations out there that can assist employers through this journey. And I would like to just invite Jamie or Jess, perhaps Jess, to speak to a new tool that we've implemented here at Northern Light Health to help link people to resources to address social determinants of health. And perhaps Jamie can add to that, but I think that it could also be of value to other organizations across the state of Maine. So I want to make sure we have an opportunity to just bring that to light as well. So Jess, could you speak to findhelp.org, and Jamie certainly add too?
Sure, be happy to. So recently, Northern Light Health implemented the findhelp.org platform for our system. If you're not familiar with FindHelp, it is a social care referral network that essentially creates and maintains a complete directory of community resources and what those resources provide, their hours of operation, et cetera, that anybody can use. You don't have to be a patient of Northern Light Health. You can log into it at any time and search for programs. You can contact them directly through the platform. You could make a list of resources and print that and give it to anybody who might be in need. And then the other nice feature that we're really working towards optimizing is that it will actually allow for referrals to be made. So a provider or even a community member could refer somebody who might be in need, or themselves if there is a need for additional follow-up or a connection to community resources. One thing that is really nice about FindHelp, for those of you who have ever tried to create or maintain resource directories, you know how labor intensive that can be, and that essentially once you make the directory, it's often obsolete. So the nice thing about FindHelp is that this is really taking that burden off of our members and program managers, and it will have that directory maintained, available 24/7, and really be able to utilize that for patients regardless of where they're seen in the state. So I would encourage, I can put the link to our FindHelp page in the chat, and welcome anybody to use that to find resources or just look around and see what the platform has to offer.
Thank you so much, Jess. And we'll make sure we also post the link on the materials page for this particular Zoom conference for future reference as well. But very valuable tool for our partners to know about, as it's something that they can access for their own needs. So with that said, we thank you all for joining us, and a special thank you to all of you, our panelists, for joining us today. Just a reminder, you can find the recordings and the materials of our Zoom conferences, including today's, on our Northern Light Health website. And I hope this hour has been a support to you, your employees, and our communities. And just a reminder, we will be emailing you a survey, and we do want to hear from you. So please please take a moment to complete that. Our next session will be on January 12th when we will ask, how are you? Join us as we discuss employee engagement and strategies for supporting a culture of caring. We will send you the registration link for this session. Please share it, distribute it with any friends or colleagues who may benefit from joining us. And of course, we hope you're able to join us as well. So thank you. I wish you all a very happy and healthy new year and happy holidays. Take care.